Hello, can you hear me now?
Yes.
Okay, sorry about that. Welcome everyone. Good morning, good afternoon, or good evening. Thanks for joining us today. Let me start by introducing myself. My name is Aynur Kadasanoğlu, and I work at the International Federation of Red Cross Red Crescent as the urban advisor. And thanks again for joining us today for the first of the webinar series that we hope to unpack how to think urban in a broader context while responding to COVID-19. As you're all aware, cities are at the forefront of not just this pandemic, but increasingly all kinds of disasters and crises. And we need to make sure that our understanding of risks, targeting, service delivery are fit for urban. Not just that, they contribute to building capacities of communities, and especially in our case, Red Cross, Red Crescent national societies, to be better prepared for future disasters and crises in urban areas. Before introducing our excellent speakers today, I would like to go first through some reminders. If you can go to the next slide, please. So first of all, this meeting will be recorded and publicly shared at the Global Disaster Preparedness Center website, preparecenter.org. So if you would like to have the link to the recording, we will be able to share it. We will ask you to put your name and email in the Google Doc. That the link is in the chat box, and we'll put it again if you can see it. And we will also use this Google Doc to take some notes and take your questions as well. So please, from the beginning, you can start adding your questions there. And if you edit your name and email, and even if your question doesn't get answered during the webinar, we will get back to you with the answer. So I will encourage you to add your name and email in that Google Doc link that is in the chat box again. For today, we will have two excellent presentations from Philippine Red Cross and Lebanese Red Cross, followed by a short breakout group session, because we would like to hear from you, your feedback, your reflections, and then we'll come back and quickly report back to the plenary, to the group. I'll give more instruction when the time comes. And of course, needless to say, please stay muted during the webinar. So I mentioned that we have speakers from Philippines Red Cross and Lebanese Red Cross. We have Miss Jessilou Moringo from Philippines Red Cross. She is the head of Disaster Recovery Unit. And we have Shevki Amin Edin, who is the COVID-19 response coordinator from the Lebanese Red Cross, together with Kasım Çalan, who is the disaster risk reduction program manager of the Lebanese Red Cross. Without further ado, we'll start with Philippines Red Cross, and Ms. Moringo, the floor is yours, and we can have the presentation as well.
Okay, so good evening, everyone from the Philippines. First of all, I would like to say thank you to IFRC Urban Collaboration Platform for inviting the Philippine Red Cross to share our experience in the COVID-19 response. I am Jessilou Moringo. You can call me Jessilou for short. I am the Disaster Recovery Unit Head under the Disaster Management Services of the Philippine Red Cross. Next slide, please. Just to give everyone the latest situation of our country, the Philippine Department of Health confirmed its first case of COVID-19 on January 20 of this year, with local transmission identified on March 7. As of June 10, the Philippines has recorded more than 23,000 confirmed cases, more than 4,000 recovered, and 1,027 deaths. The Philippine government implemented a Luzon-wide enhanced community quarantine from March 17 to May 31 in an attempt to limit population movement and curb the spread of the pandemic, as most of the cases are situated in Metro Manila. This was lifted to general community quarantine last June 1, 2020. The Philippine Red Cross, as the leading humanitarian organization in the country, responded to pandemic crisis through the 4 pillars of its COVID-19 response plan of action. I will just briefly discuss the different activities under every pillar. Starting off with Pillar 1, surveillance. This aims to address concerns related to COVID-19 and provide referrals to health authorities through the establishment of hotline, or what we call helpline. This operates 24/7. Pillar 2, support to healthcare system and authorities. The Philippine Red Cross has pitched medical tents in different hospitals, which are now being used as medical, admission, and triage purposes. PPEs and psychological first aid were also provided to the frontline workers. We also have ambulance units, which are used to transport COVID-19 patients, and the PRC has its own COVID-19 testing center, which increased the testing capacity of the country. Moving to Pillar 3, this focuses on our responses to the communities. This includes provision of hot meals, relief assistance through cash grants, and establishment of hand-washing facilities with hygiene promotion at the community level. And lastly, Pillar 4, these are the PRC measures and modifications to ensure that we are still able to continue our regular services both at the headquarters and chapter and branch level. All of the mentioned activities are being simultaneously done by our 104 chapters within the country. However, in terms of funding support and scaled-up response, the focus is Metro Manila and the areas who have extended their enhanced community quarantine. Next slide, please. Due to the strict enforcement of community quarantine, there was a challenge in continuing our response operations, especially to the areas that were seriously hit by this public emergency. As we understand the safety concerns, especially for the volunteers and staff who are being mobilized, we have developed special modifications in the process by incorporating the guidelines on preventive measures for COVID-19 transmission released by the government and the Philippine Red Cross. First off, coordination with stakeholders. The Bayanihan to Heal as One Act identified Philippine Red Cross as a key partner of the government in the distribution of goods and services in response to the effects of the pandemic. This emphasizes and strengthens our auxiliary role to support and supplement government efforts. Step-by-step process emphasizing the need for community engagement and participation were briefly discussed to the leadership and technical stakeholders. This is also our way to secure guidance from them, set specific limitations, and ensure that our process and interventions are applicable to their context and needs. All agreements were documented, put into writing and duly signed and acknowledged by every party. Second is the mobilization of the Red Cross 143 in all activities. To ensure a more efficient and effective response intervention, the Philippine Red Cross mobilized its pool of community volunteers, or which we call Red Cross 143 or RC 143. The good thing about RC 143 is that it already existed even before COVID. This is the program of our chairman, Richard Gordon, which was created to build community resilience through volunteers who will act as our eyes, ears, hands, and feet on the ground. This is called RC143, not Red Cross I Love You, but because it is composed of one leader and a minimum number of 43 members, which makes 44 volunteers in every community. And they will take charge and be the first to respond in times of disaster and emergencies. In connection with the COVID-19 response plan of action, the Red Cross 143 is one of the key components why we are able to implement our response activities in a timely manner. The Red Cross 143 volunteers have been involved in the activities mentioned under Pillar 1 and 3. Under Pillar 1, trained volunteers handle the calls, provide reliable life-saving health information, dispel rumors and misinformation. If calls received are regarding COVID-19 symptoms and precautions, there are volunteer doctors available and ready to provide advice whether hospitalization may be required. This helps decongest overwhelmed medical facilities by providing a first layer of screening. There are also volunteer social workers who are providing psychosocial support to callers for mental health as well. Moving to Pillar 3, one of the key interventions implemented by the Philippine Red Cross is the provision of relief assistance through multi-purpose cash grants or the MPCG. The assistance aims to provide immediate assistance to the affected families, particularly those who lost their livelihoods due to the enhanced community quarantine or the lockdown. In terms of beneficiary selection, through the Red Cross 143, we were able to come up with a vulnerability criteria of priority and less priority households. Through our consultative meetings and informal dialogue, we were able to discuss how their community members have been affected and cope up in different ways. So for example, they understood that there are families which are also affected by the pandemic, but they are less priority since they are relatively better off and can cope up within their own means. They also understood that those who have received assistance from the government or other organizations are less priority. Even though the Philippine Red Cross has set criteria on who to prioritize, the Red Cross 143 made it more contextualized and applicable to their community. Since it is them who set the criteria, it reduced grievances, and they themselves can answer those questions concerning the selection process even without the Red Cross team. This implies that there's a clear understanding of the process. Next off is the Red Cross 143 mobilized to conduct needs assessment and health promotion activities. As mentioned earlier, PRC will be providing cash assistance to the affected families. One of the modalities has a similar concept with cash for work, but the work is focused on defeating the virus and knowing the needs of the community. Thus, we call it cash for needs assessment. The Red Cross 143, whose livelihoods were dependent on the no work, no pay scheme, or those who belong to the most vulnerable sector, were identified as recipients of the cash assistance. These Red Cross 143 are grouped together and scheduled for 7 days to do the following. So there are groups who will be assigned to do blood recruitment, conduct needs assessment and profiling, groups that will distribute IEC materials related to COVID, and also groups that will disinfect at the community level. There are also groups who are mobilized as community health surveillance team, conducting health assessment, tracking down individuals with symptoms so that they can be referred to appropriate health authorities. Lastly, Red Cross 143 supporting us in the distribution of the food items and cash grants. Since we have limitation in deploying chapter volunteers and staff, we have mobilized Red Cross 143 to fill in the gap of manpower during the distribution. They act as our focal points for beneficiaries to assist them throughout the whole process of the cash distribution. Like for example, they tell where the proper entrance and exit is, checking and ensuring that the beneficiaries have brought with them their beneficiary card or identification cards. And also they act as crowd control, wherein they notify beneficiaries from their seats when it's their turn to collect the cash. The last modification is the preventive measures during the cash or in-kind distribution. So I will be discussing how the Philippine Red Cross modified the process of cash distributions, considering the limitations of the movement, restrictions on mass gathering, and risk of spreading the virus. I am going to show you a video while I discuss the procedures. Next slide, please, for the video. The video was shot during the distribution of cash for relief assistance for Taal volcano eruption affected communities in the province of Batangas. Please note that the area of intervention is suburban, under general community quarantine, and has more than 300 cases of COVID-19. The video is in Tagalog, so I'll be explaining it to you in English while we go through the procedures. PRC put up 2 hand washing units in the distribution area, which were used by all individuals present at the distribution site. Prior entry to the venue, PRC personnel checked beneficiaries' temperature and were advised to wash their hands with soap and alcohol. Also, beneficiaries were advised that if they feel sick, they can send a representative from the household to receive the cash. The distribution was done per zone, limiting 10 to 20 beneficiaries in one site or depending on the venue. Beneficiaries have to bring with them valid ID and the PRC beneficiary card. First step is registration and verification. PRC volunteers will counter-check if the names on the card are listed in the distribution sheets. Once verified, PRC will sign the beneficiary card and the payroll and the distribution sheet. As you can see in the video, we have used a wood and a basket where exchange of items is being done. I think there's a problem with the video. So going back, as mentioned, as you can see in the video, we have used wood and a basket where exchange of items is being done. This is to maintain social distancing between PRC personnel and beneficiary. But to continue, step 2. Step 2 is the cash releasing. The beneficiaries will sign the payroll list, acknowledging the receipt of the cash assistance. With these records, cases of double counting will be eliminated. So every beneficiary were also advised to count the money before they exit the distribution area. So same with the registration sheet, registration table, we also used wood and a basket for exchange of. So the last step is the exit interview survey. Okay. Yeah, so just to continue, the last step is the exit interview survey, where beneficiaries were randomly selected to check whether there's a need to improve or retain in our process. So this is done through ODK Collect. Same goes 2 weeks after the distribution. Post-distribution monitoring will be done to check whether our cash transfer has had the expected outcomes. So all of the process you have seen is also done during the distribution of in-kind items, such as the distribution of shelter toolkits and tarpaulins in Mindanao earthquake operations. So next slide, please. The last slide is PRC's framework that illustrates the components that constitutes our definition of a safe and resilient communities. All of the activities mentioned aim to contribute to the different components in order to support local communities for them to be able to cope and respond to future disasters. So like for example, mobilizing Red Cross 143 contributes to a component of social cohesion, wherein Philippine Red Cross staff and volunteers act as agents of resilience and active beneficiaries. Strong information dissemination related to COVID-19 contributes to the first two components. And lastly, the provision of cash grants, may it be for livelihood, relief, or shelter assistance, contributes to the fourth component. The Philippine Red Cross, through the support of IFRC, partner national societies, and various stakeholders, has scaled up its response to ensure that no one is left behind. Thank you for listening, and please let me know if you have any questions.
Thank you so much, Jessilou. This was really great. So what we will do is we will move to Lebanese Red Cross presentation. And after that, we will have a small, very short breakout groups. But we will come back and have some time for questions and answers. Again, please add your questions to the Google Doc. If somehow they cannot get answered, we will come back to you with the answers. And the Google Doc link is in the chat box again. Great. Now, I believe, Shevki, you will go first, right? And Ian, can we have the presentation? The floor is yours, Shevki.
Thank you.
You can start while we are having the presentation set up. We can start.
Okay. So my name is Shaw Amin Deen, and I'm the COVID-19 response coordinator for the Lebanese Red Cross. And today I will be presenting our experience among in response to COVID-19 regarding working in urban setting and working especially on resilience. So the title we chose for our presentation is Transforming Global Threats to Local Opportunities, because that's really what COVID did for the Lebanese Red Cross. So to start with an overview of the current context of the outbreak of the disease in Lebanon, if we can move to the next slide, please. Lebanon started recording the first cases of COVID-19 on February 21st, 2020. And since then, Lebanon had a total of 1,402 cases, with a total death toll of 31 cases and total recoveries of 843. And as you can see from the epidemiological curve that's being shown in the screen, Lebanon has already had its first wave and started its second wave. And the second wave was linked directly to the opening of the airport in order to allow the repatriation of the people, of the Lebanese people who were present outside Lebanon. And that's which was the main cause for the contribution of the increase in the number of the cases. So if we look quickly at the map that shows the distribution of cases among the different districts in Lebanon, we can see that most of the cases that have high density of cases are cases that include places where the major cities in Lebanon are located, such as the capital, Beirut, Tripoli, Shuf area, Alay, Zahle, and Tir, as well as Saida. And these are mainly the big cities in Lebanon, which really required an intervention that takes into consideration the urban setting in which we work. So when the Lebanese Red Cross initiated its response, it has set 6 response objectives along with 4 pillars. So if we can move please to the response objective, to the next slide. So the first response objective was mainly set on the detection, which is mainly related to the identification of suspected and confirmed cases via the national emergency number operated by the Lebanese Red Cross dispatch centers, which is the 140. And this includes the medicalization of dispatch in order to be able to receive the high load of cases and calls, because we are receiving calls mainly from highly populated areas. The second objective was mainly associated with the work of our emergency medical services, and it focused on the transport of suspected and confirmed cases. The third objective was related to the risk communication, community engagement, and public awareness. And this is the part that we will be focusing on in this presentation. Our fourth objective was maintaining services, because especially that we are working in urban settings, many of the services provided by the Lebanese Red Cross were considered critical, such as the blood banks, the primary healthcare center, the relief activity, as well as the non-COVID EMS activities. So maintenance of services was one of the main strategic objectives. Our fifth objective was providing shelter, and mainly for people, for refugees or displaced people who required quarantine. And our sixth and final strategic objective was providing basic assistance for affected Lebanese and refugees who are in quarantine and are considered among the most vulnerable, in order to be able to deal with the economic impact of COVID-19, especially that in Lebanon, we are experiencing COVID-19 among an ongoing economic crisis that has been going on since October 2019. And in order to ensure the implementation of these six strategic objectives, LRC worked mainly on four pillars. Pillar number one is ensuring a proactive response, and we will detail that. Pillar number two is ensuring a database response. Pillar number three is ensuring a safe response. And pillar number four is ensuring a scalable response. And throughout this, we have learned four main lessons. If we can go over these quickly. These include applying a multi-hazard approach, building on previous preparedness and DRR efforts. Next. Leaving no one behind. And finally, ensuring a proactive and data-driven approach. I will give the floor to Qasim, who's our DRR unit director, in order to elaborate more on these lessons learned, which are related to urban resilience, as well as give two examples of urban resilience within COVID. Qasim?
Yes, thank you, Shawki. Hi, everyone. So more focus on this presentation. So for us, by planning for the and applying multi-hazard approach at the beginning when COVID-19 started, for us it was something new, and especially when it comes to the awareness and the community engagement. So what we've done, we use our onion model, and with this model we use our existing structures and our existing relation with the community and the authorities. So we start within the community level up to the national level. We were able to be part of all the decision and support the community and the local authority to take the right decision, because the Red Cross are present on the governorate level and the national level, and we were able to identify the gap together with the government and the local authority, and especially when it comes to the national level, there where we had most of the UN agency, and again we had like another discussion with them to set way forward for the implementation. So, and again, by making sure with all these links, they are linking to each other, that means they are feeding to each other and they are supporting each other, and they can maintain the sustainability for the intervention. And as we go with the intervention, we are not looking only about COVID-19, we are looking how we can benefit from this intervention to be more prepared for any second wave or for any other crisis. So next, please. Next. So here we'll speak about two examples. It's one with one of the city where we were working, and the other example it will be big city in Beirut where we started during COVID-19, and we show really big difference between community were prepared and community were not prepared. So for example, this area in Tyre, we are working with them more than 5 years. The community had very limited intervention from the Lebanese Red Cross. The only intervention were how to deal with dead body from the COVID-19. As you can see from the picture, The community have access to data, have access to resources. They are using the GIS to take the decision. They are well connected with all of their local stakeholders and community leaders and the religious. And as you see as the last pictures, all the response agency, they are sitting together. So for us, it was showing clearly all the preparedness that we've done through all the several years. The community was ready to respond. The only thing what we've done, there is small adaptation towards this kind of intervention, because most of the preparedness were focusing more on the natural hazard and the man-made hazard, it less on the epidemic. So just like small adaptation with more awareness, a community ready to engage. Next, please. When it comes to Beirut, and Beirut is the capital of Lebanon, and Beirut is a very busy city. And for us, it was really very difficult to engage with the people there. So as I told previous that we look at the COVID-19 as an opportunity for us to empower more the urban cities. So there the mayor and even the community there, they had like panic and they were confused from where we need to start. There's big populations there. So again, as I present before, that the Red Cross present in all the structures. So we knew where is the gap from the governor. We went straight to the local communities through the mayors, and we start to work with them more on the awareness and then coping and then the adaptation as adapting. And here where we use between the coordination between the Ministry of Labor and the Ministry of Education, we found that we need pool of volunteers. So we have 2,700 volunteers from the university. We use the task force for the GIS in order to deploy all these volunteers to support the government and the ministry to go back to business, back to school, back to garderies, back to the normal life, in order to use all these resources and to make sure people with a very high population are less vulnerable and they are more prepared. Next, please. You can open all the pillars. So the success, why we had the success factors and the effectiveness, because we had the right tools, knowledge and expertise, the database response, and again, the data, it was based on the collected data based on the GIS and data driven. We were, as we go, we were adapting and taking all the lesson learned, and we were flexible, and we were doing like response for the phase one, and then we are doing preparedness for the phase after. So for example, when we start the awareness session, we knew that we will come to the phase where we will not be able to go face to face. Here where we start to do the e-learning, the online training, as well to be prepared for back to business. So for us, we were prepared as we go. We were giving support to all of the relevant ministries to support the community with timelines, building on pre-existing structures, and then we can build on that for any future crisis, network coordination, reliability, and acceptance. And all this will take us to the sustainability. You can build on all what I covered on the policy, dialogue, partnerships, community engagement, and one important thing is the community should be always in lead and center. So this is the last slide, and here just allowed me at the end just to thank the German Red Cross really for all their support and effort during all this process.
Thank you so much, Qasim. So now we will come back with questions, but for now, we would like to break you into groups, and we will ask you to kindly reflect on for the future-looking discussion we are expecting. So we will ask you to, based on what you heard and your own experience, maybe have a small discussion with your group about how will all these experiences, COVID-19, the new ways of doing things will affect the way we work in urban areas, and what will change. So it will be great if you can focus on like what will change for us. What does that mean? All these experiences for us. And please, in your group, identify one person when we get back to the plenary. Just highlight one thing, not everything. We don't expect you to report all the discussions, which I'm sure will be very rich, but just one thing. And if you can kindly also add your group discussion, some main points in the Google Doc that you see the link in the chat box, that will be really useful. And we will collect all these feedback and we'll share it back with you and with other whoever is interested. So I'm just going to now create the breakout groups, and I'll see you in 10 minutes then. Hi, did someone ask for help in your group?
Hi, this is Anna.
Yes.
Anna from Cell. But I don't know, it's like I enter in the group, but like it seems nobody else is there.
Oh, nobody's there. Okay.
Hello.
It seems quite, oh, hi. I can see the number, I can see who is in the group, that's why.
Okay, I see Clement, I see Shak in your group, right?
Yeah, that's right, I'm here.
Okay.
I think Clement needs to unmute herself.
Oh, I see now. Okay, I'll try to do that. But I need to get out of this room, I guess, for that reason. So I'll leave you alone and try to fix the issue, okay?
Okay.
Sorry about that.
So, hi, Anna.
Hi.
Hi.
How are you?
Good, good. So, going back to the question that Einar asked,
yeah.
How do you think this would affect our work in future in terms of building urban resilience?
It's
Welcome back, everyone. Can you hear me all?
Yes, I can hear you.
Okay, great. Thank you very much. So we are having participants coming back to the plenary soon, slowly. And we'll start maybe see if breakout room 1 is ready. Anyone from the room breakout group 1? I see Gabriel, Keith, Samson. Anyone would like to report back, please? Very quickly. Maybe they haven't come back yet. Anyone from group 2? I see Anna, Clemens, Joe. No. All right. Guess we'll wait a little bit more. So any group who is ready to report back?
Group 5.
Go ahead, please.
Yeah. We have, initially we have technical problem, but we try to manage on the discussion that the colleague from Lebanon and myself, Indra from Nepal, working in the Asia Pacific as DRR coordinator.
Thank you very much.
Now, the success behind the response in the urban area and the utilizing the existing mechanism that has become more takeaway message. Like the first one is the involvement of the mechanism that was prepared in time of DRR from community through the government, and that has been mobilized in time of this COVID-19. And therefore, the time to prepare for national society took a short time, and they started to respond. Second, they had data collection in time of DRR for community resilience, and they mobilize or they utilize that data themselves as well as they provided to the authority, and that was also equally useful for this time of response. And the other one is they prepared volunteers in time of DRR, but they provided general training on COVID, and then they mobilized. So that became an instrument to immediately respond to the current crisis.
Okay, thank you very much. We'll move to another group, but I will again remind you that if you could just highlight one very interesting point, looking forward, what will it change? How will this change the way we work? So I'm sure it's all very interesting discussions, but for the sake of the time, if you could just highlight one point, that would be great. So we heard from group 5. Maybe I can ask, go back to group 2. Anyone is ready from group 2? Anna, Clement, Joe, Shavke? Any one of you? Okay. So I'm going to then ask who is ready, which group is ready, which group would like to take the floor?
It's Raymond from group 4.
Okay.
If that's okay.
Yes, sure. Go ahead, please.
Two very practical things are hygiene practices and working more online, working more remotely. One more organizational impact will be the links and the shifting between short-term perspective versus long-term needs and the impacts of long-term developments on short-term needs. I think these are some of the highlights of our group. Thanks.
Yeah. Thank you, Raymond. Anyone else who is ready to report back?
Yeah, Volker from group 3. The onion model. That means collaboration on all levels, starting with the community, working for and with the community, and up to the national level, really being in coordination with other capacities, other actors, state and non-state actors, in order to really create synergies and to build upon data that is available in every niche. So the Red Cross itself cannot do everything. So this onion model is a good role model for stretching out and building national systems and leave a kind of silo mentality.
Thank you very much. Really interesting reflections. Moving on, anyone else, please?
Yeah, hi. I'm not sure which group I was representing. I think group 7, Alexander here from German Red Cross. We had a conversation surrounding more the sort of BCP approach. And I think, what this situation has really highlighted is that when it comes to managing organizations, managing national societies, there is a need for greater flexibility, not just in the short term, in the long term, where management structures are in place that give employees greater freedoms and greater benefit of the doubt. I mean, there must be other control and oversight mechanisms to make sure that work is done, other than just simply making sure that people are in the office.
Yep, very good point.
Exactly.
Very good point. Thank you very much. Okay, another group, please.
Yes, we can go next. This is Sandra, but I was working together with Ulrich, German Red Cross, Yara, and Elsa, so movement and non-movement partner. We had 2 points which were quite clear to all of us: the importance of local actors. So we see in the example between Tyr and Beirut, it is fundamental to build on existing structures and tweak or adapt those, and existing services. In these times, it is too difficult to swap to new programs. You have to build up on the services which are already strongholds of the national societies. And the second point, which seemed to be really crucial now, and we can move on that, in urban areas, the need for data, share those data, sharing data around the data collection in urban areas, of the spread of the pandemics, mapping of buildings, organizing mapathon, and digitalization becomes crucial, especially in times of lockdown. So use all the tools that we have, from social media to new technologies, to ensure that that's also done among both movement and non-movement actors, sharing with and that's all from our side.
Couldn't agree more. Thanks a lot, Sandra. Okay, any other group, please?
Hi, Ainer.
Okay, Catalina, you go.
Hi, Ainer. Thank you. I was in group 8 with Nadia Ortega from Americas. Well, 2 main things that we discussed is the relevance of building up on the services and the strengths of the national societies and the communities, and how and on the things that the national societies have already worked with the communities and work from there the programs. And the other things, how to use these challenging times to strengthen the communities and to empower them in taking actions towards the response. So to basically those 2 things.
Great, thank you very much. I know that not all the groups were able to report back, but for the sake of the time, I would like to give some time for the question and answer. And if you could, please, for the groups who couldn't get report back, if you can add your points to the Google Doc, that would be really appreciated. With that, I'm looking at the questions that you all put. Thanks a lot for that. And I'm going to pick few of them for our presenters to answer. There is one for Philippine Red Cross. How do you decide the requirement for receiving the cash aid? I believe that's more about how did you target, how did you identify people, especially in the times of lockdown and social distancing. Jessilou, do you mind giving it a go?
Yes, so in terms of selection, as mentioned a while ago, we are mobilizing our Red Cross 143 in contextualizing our criteria selection. So, though the Philippine Red Cross has already a set of criteria which is targeting those families who are dependent on the no work no pay scheme, but then we're still seeking advice from the Red Cross 143 on contextualizing the selection process. In terms of the requirement for receiving the cash aid, so it's already part of our standard operating procedures wherein the beneficiaries should present their identification card together with their PRC beneficiary card so that they will be able to receive the grants. So this is already part of the information dissemination before they go to the distribution site. So it's already part of the standard operating procedure.
Okay, thanks a lot. There's another question for you, actually. Maybe I can move that while we have you. Are there any PNSs was part of the program, that prevention, preparedness, response that you just summarized for us?
Yes. So IFRC is the main partner of the Philippine Red Cross in terms of COVID-19 response, especially in the funding the molecular laboratory, support to healthcare system, which is the Pillar 2, and then community support through cash grants. So other partner national societies supports PRC by incorporating DRR and health by supporting communities such as hygiene promotion and COVID-19 prevention in their targeted areas as well. So we are not only working on COVID-19 response, so there are partner national societies working with DRR and health in different targeted areas. So they are supporting us in incorporating preventive measures in those areas as well.
Okay, thank you. There's an interesting question. Maybe I can ask Lebanese Red Cross start, and we may come back to you. Which possibilities do you see to positively influence government response to COVID-19? That maybe, I think this is about our influence in government, a positive influence. For example, alternatives to negative impact of lockdown, and reaching out to marginalized groups. Shevki or Kasım, would you like to go first?
If you allow me, one of
please.
mainly the things that allowed the Lebanese Red Cross to be able to work in this place is that even before the COVID outbreak started in Lebanon, so back in January 2020, the government created a governmental committee formed of ministries that would, the main role was to work on prevention and preparedness and even response to COVID-19 in case that happens. And since the Lebanese Red Cross has been working for a long period with the government through various programs, including DRR, the Lebanese Red Cross was one of the key actors and one of the members in this governmental committee. And this allowed us as a national society to do two things. One, to be partners in decision making when it comes to major decisions that would affect the whole outbreak, ranging from lockdown to closing schools to opening the airports or closing the airports and so on. But it also allowed us to lobby and to advocate for the most vulnerable groups that usually can be forgotten when the governments are trying to reach out for the response. So these two things allowed us to stick to the humanitarian principles, to reach out for the marginalized people and to the vulnerable groups, as well as to participate in the decision making at the national level.
Thanks a lot. While we're on the local government topic, there is a question actually I would ask you both, which is the recovery planning phase. I mean, I think you answered a lot about the response and what's happening now, but do you think that how will your national society working with local authorities on recovery planning for the longer term planning? Are there any that kind of activity going on that your national society
I think Qasim can explain the return to business as part of the recovery phase. Qasim,
yes, thank you, Shawki.
He's being on that part.
So I think here now I will go back to the onion model. So based on our meeting at the DRM with at the Prime Minister office, so we try to understand from the different ministry where's the problem. From the Ministry of Labor, Ministry of Health, so and then back on the community level, because we were listening to them and we knew where is the gap. So decision was we start to use a smart system through the survey 1 to 3 on the GIS. So when it is to go back to school, we agreed with the Ministry of Education to give them training about the key elements, and at the same time we'll give like online training and we'll give this survey to all the school on the national level. So we'll be able with a very small time using the technology, and we'll be able to reach more people. This is the same for the garderies, and the same for the normal business. In order to do that, we look at this pool of volunteers from the university and the communities. Now we have almost around 2,700 volunteers. They engage because of this intervention. So we didn't look at these volunteers only for COVID-19. And then we have this volunteer, but there's no structure. So Lebanese Red Cross, with the coordination with the ministries, we had coordination for this group on the regional level. Coordination is not enough. So how we can continue give them tasks? We use the GIS for the task force. Task force, we knew exactly where they are, and we can give them tasks. Again, that is not enough. How we can do analysis for that? So through the surveys, it will go back to the dashboard, and it will give us indicators if the population in Lebanon respecting the social distance, if the population in Lebanon following all the elements and the key in order to go back to business safely and without go back again to outbreak because of mass behaviors from the communities. So to recap in all this, yes, we are playing big roles, because we are very strong on the community level, we are very connected on the national level, and we were able to do the change, and we are linking everything to the system, and that means in case of any crisis, it's not only COVID-19, we will be more prepared because we will be using these structures for the future.
Thank you very much, Qasim. I would like to give Jessilou also the floor to maybe talk about, in Philippines case, about the recovery planning. How do you work with local governments?
Yes, so in terms of recovery planning, now for our plan of action, we are more focused on the immediate assistance, but what we are doing now is mobilizing this Red Cross 143 in seeking or in assessing the possible recovery needs of our population. So this is part of our cash assistance, wherein doing the needs assessment and profiling. So the RC 143 will provide us feedback on the socio-economic effects of our at the community level, so that it will be part of our, so it will help us in our planning the recovery plans. So we are looking into supporting the effects of economic or livelihood insecurities, especially now that this is the sector that is highly affected because of the enhanced community quarantine.
Exactly. Well, thank you so much. We're a little bit over time, but I think we did well in general. Thank you very much for joining, but special thanks to our presenters. Just a quick reminder, you still have this Google Doc. Please add your questions, and we will continue to use webinars, and we will also continue to collect these questions, but also your comments. Please feel free to add, and we'll compile them and get back to you as maybe a small, note about, how this is all affecting our urban resilience programming in the future as well. This is the main topic of these webinars. And thank you again for your time. Bye.
Thank you.
Thank you very much. Looking forward to next week.
Thank you so much. It was very interesting. Thanks.
Thank
you very much. Bye.
Bye.